Pregnancy encompasses the period in which a fetus grows within the uterus, typically lasting around 40 weeks. However, it's crucial to recognize that pregnancy can bring about various health conditions and disorders that pose risk to both the mother and the baby. These ailments may arise during pregnancy and persist afterward, potentially impacting the health and well-being of the mother for a lifetime. Hi, I am Princess Erica F. Compañero, and I will be discussing about the HELLP syndrome in multiple pregnancy. HELLP syndrome, though it is rare, presents a significant threat to maternal and fetal health during pregnancy. This condition precipitates the destruction of red blood cells, liver dysfunction, bleeding tendencies, and elevated blood pressure. It frequently co-occurs with preeclampsia and eclampsia, and it commonly manifests prior to childbirth. So what is preeclampsia and eclampsia? Eclampsia emerges as elevated blood pressure, edema, or increased albumin level in the urine occurring from the 20th week of pregnancy until the first week post-delivery. Eclampsia, on the other hand, manifests as seizures or coma without identifiable causes within the same time frame. These conditions pose serious risk to maternal and fetal health during pregnancy and the immediate postpartum period. So in simple terms, preeclampsia and eclampsia are pregnancy-related high blood pressure. The only difference is that preeclampsia is a sudden spike in the blood pressure, while eclampsia is a more severe and can include seizures or coma. Let's move on to what HELP stands for. H stands for hemolysis, which refers to the rupture or breakdown of red blood cells leading to the release of hemoglobin into the bloodstream. EL stands for elevated liver enzymes, that indicates abnormal levels of liver enzymes in the bloodstream, suggesting potential damage or dysfunction of liver cells. This damage alters the normal functioning of the liver and may impact overall health and well-being. Next is the LP, stands for low platelets, or also known as thrombocytopenia, that denote a decrease in the number of platelets circulating in the bloodstream. Platelets play a crucial role in hemostasis, facilitating blood clot formation to regulate bleeding. When platelet levels are deficient, it can lead to impaired clotting ability and increased risk of bleeding complications. What really causes HELLP syndrome? Healthcare providers don't know what causes HELLP syndrome, so it is unknown. But there are risk factors for HELLP syndrome, such as age greater than 35, obesity, history of preeclampsia, history of diabetes or renal disease, history of multiple births, and history of high blood pressure. Often, women with HELLP syndrome exhibit high blood pressure and are previously diagnosed with preeclampsia. However, in certain instances, symptoms of HELLP syndrome serves as the initial indication of underlying preeclampsia, highlighting the importance of vigilant monitoring and early detection in prenatal care. The symptoms of HELLP syndrome are fatigue or feeling unwell, fluid retention and excess weight gain, headaches, nausea and vomiting that continue to get worse, pain in the right upper quadrant or mid part of the abdomen, blurry vision, nosebleed or other bleeding that will not stop easily, which is rare, seizures or convulsions, which is unusual, proteinuria, edema, and high blood pressure. The condition with these presenting symptoms is sometimes misdiagnosed as flu or other viral illness, gallbladder disease, hepatitis, and etc. We have numerous tests to diagnose HELLP syndrome, which includes blood pressure measurement, red blood cell count, measurement of bilirubin level, which is a substance made by the breakdown of red blood cells, liver function test, which liver enzymes may be high, platelet counts that may be low, and urine test for protein. The treatment for HELLP syndrome are bed rest, and it's either at home or in the hospital, blood transfusion for severe anemia and low platelet count, magnesium sulfate to help prevent seizures, medicines to lower blood pressure, hospital stay with fetal monitoring. This includes non-stress testing, which evaluates the fetal heart tone in response to fetal movement. During these tests, the healthcare provider monitors the baby's heart rate to assess its reactivity and response to movement. Next is the biophysical profile, that is a comprehensive assessment that integrates both non-stress tests and ultrasound imaging to evaluate the well-being and development of the fetus. These tests provide a detailed examination of the baby's health by assessing various parameters, including the fetal heart rate, fetal movement, muscle tone, breathing movements, and amniotic fluid levels as visualized through ultrasound. Another is the Doppler flow studies, which involves the use of ultrasound technology to assess blood flow within the blood vessels by measuring the velocity and direction of blood flow using sound waves. This diagnostic technique provides valuable information about the circulation and function of blood vessels, aiding in the evaluation of various vascular conditions and disorders. Last is the corticosteroids medicine to help the baby's lungs mature for delivery. There can be complications before and after the baby is delivered, including disseminated intravascular coagulation or DIC, which is a clotting disorder that leads to hemorrhage, pulmonary edema, that is a fluid in the lungs, kidney failure, placenta abruption, which is a separation of the placenta from the uterine wall, liver hemorrhage and failure, seizures, stroke, fetal complications, including the restriction of fetal growth. In cases of severe HELLP syndrome, both maternal and fetal health may be at risk, necessitating early delivery of the baby to mitigate the potential complications, and the recovery from HELLP syndrome can be prolonged, often requiring several days post-delivery for the mother to recuperate fully from the condition. And early diagnosis of HELLP syndrome significantly improves outcomes for both mother and baby. Regular prenatal checkups are crucial for timely detection and intervention. It's essential to promptly report any symptoms of the condition to your healthcare provider, as awareness of warning signs enables early treatment and prevents disease progression. So we've come to an end to the first topic. Now let's move on to the second and last topic, which is the multiple pregnancy. A multiple pregnancy is when a woman carries more than one child at the same time. Triplets are identified when 3 babies are carried during a single pregnancy, whereas twins are commonly known when there are 2 babies. A high-order multiple pregnancy is one in which a woman is carrying more than 3 babies at once. Multiple pregnancy are typically associated with higher risk for the mother and the unborn child, requiring close medical supervision and monitoring throughout the pregnancy as opposed to singleton pregnancies. So, how do multiple pregnancy happen? There are 2 main ways that a multiple pregnancy can happen. First, if one ovum splits before it implants in the uterine lining, when embryo splits at an early stage of development, producing identical multiples, the offspring will have the same genetic composition. Consequently, identical multiples will be at the same sex and have remarkable physical similarities. The second way is 2 or more separate eggs are fertilized by different sperm at the same time. Because these are different eggs and different sperm, the genetic material is varied. These children won't look identical and can be different sexes from each other. In pregnancies involving triplets or more, the babies can be all identical, fraternal, or a combination of both. This occurs when the woman's body releases multiple eggs and each egg is fertilized. In cases where there are both identical and fraternal multiples, it means that more than one egg was fertilized, and at least one of those fertilized eggs subsequently divided into identical embryos. To understand thoroughly on how twins really form, let's watch a video.
Have ever wondered how 2 people can come from one egg? How can 2 individuals that stayed together in the same womb look different? In this video, we will explore the fascinating science behind how twins are formed and the different types of twins that can occur. The process begins during intercourse when up to 30 million sperms are introduced into the female genital tract at the time of ejaculation. Human sperms are motile and rapidly swim upward from the vagina to enter the cervix. The sperms move toward the ampulla of the fallopian tubes. This is the site where the egg is found and fertilization takes place. Only a few hundred among the millions reach the site of the egg. A single sperm enters the egg and releases its genetic content. The male and female contribute half of the chromosomes to form a zygote. In non-identical twins, 2 separate eggs are fertilized by 2 separate sperms, also known as fraternal or diazygotic twins. The fertilized eggs then develop into 2 separate embryos, each with its placenta and amniotic sac. They each grow and develop in their separate environment in the uterus until they are ready to be born. They can be of the same or different sexes. Twins can also be formed when a single egg is fertilized by a single sperm, which then divides into 2 separate embryos. These are known as identical or monozygotic twins. These twins will have identical genetic makeup, they are always of the same sex, and look very much alike. This division can happen at any point between fertilization and the formation of the blastocyst, but usually occurs shortly after fertilization. If the division occurs within the first 72 hours after fertilization, in this case, the twins will have different placentas and separate amniotic sacs, also called dichorionic diamniotic twins. When the division occurs between 4 to 8 days, it results in twin babies sharing the same placenta, but each with separate amniotic sacs, also called monochorionic diamniotic twins. When the division occurs between 8 to 13 days after fertilization, both twins will share the same placenta and the same amniotic sac. These twins are called monochorionic monoamniotic twins. Attempts at division after 13 days result in incomplete separation and the formation of conjoined twins. No matter how many times the question is asked, how fertilized egg divide to form twins, the answer remain a mystery. We may never know the exact mechanics of how two offspring come from a single egg, but it is a fascinating topic.
So now that we already understand how do multiple pregnancy happen, let's go on to the factors and causes of multiple pregnancy. The first naturally occurring factor is the heredity. A family history of multiple pregnancy increases the chances of having twins. Next is the old age. A woman's likelihood of having multiple conceptions increases with age. Next is the high parity. Having one or more previous pregnancies, especially in multiple pregnancy, increases the chances of having multiples. Next is the race. More than any other race, African American women are more likely to give birth to twins. The lowest rates of twinning are seen among Asians and Native Americans. Higher order multiple births are most common in Caucasian women, especially those over 35. And there are some other factors that include ovulation-stimulating medications such as clomiphene citrate and follicle-stimulating hormone or FSH that help produce many eggs, which, if fertilized, can result in multiple babies. The other factor is assisted reproductive technologies such as in vitro fertilization or IVF and other techniques that help couples conceive. These technologies often use ovulation-stimulating medications to produce eggs which are then fertilized and returned to the uterus to develop. Through ultrasound, we can know if you're having multiple pregnancy. During this test, your provider can look at images of the inside of your uterus to confirm how many babies are in there. You might experience more intense symptoms during the multiple pregnancy than with a single pregnancy. This includes severe morning sickness, rapid weight gain in the first trimester of the pregnancy, sore or very tender breast, high human chorionic gonadotrophin levels, high amounts of protein, alpha-fetoprotein in your blood. Apart from an ultrasound, your provider might suspect multiple pregnancies if there are more than one heartbeat detected during a fetal Doppler scan. There are some complications linked to multiple births, which includes premature labor and birth, which is the most common, preeclampsia or gestational hypertension, which is during pregnancy, your healthcare provider will watch your blood pressure carefully to make sure you don't develop gestational hypertension. Next is gestational diabetes. You can develop diabetes during pregnancy. This happens because of the increased amount of hormones from the placenta. Placenta abruption. This is an emergency situation. This condition happens when the placenta detaches or separates from the wall of your uterus before delivery. Next is the fetal growth restriction. This condition can also be called intrauterine growth restriction or small for gestational age. This condition happens when one or more of your babies is not growing at the proper rate. This condition might cause the babies to be born prematurely or at a low birth weight. Next is anemia and birth defects. So multiple birth babies have about twice the risk of congenital abnormalities including the neural tube defects, gastrointestinal, and heart abnormalities. Miscarriage, which is a phenomenon called the vanishing twin syndrome, in which more than one fetus is diagnosed but vanishes, usually in the first trimester, is more likely in multiple pregnancies. This may or may not be accompanied by bleeding. The risk of pregnancy loss is increased in later trimester as well. Next is the twin-twin transfusion syndrome. It is a condition of the placenta that develops only with identical twins that share a placenta. Blood vessels connect within the placenta and divert blood from one uterus to the other. It occurs in about 15% of twins with a shared placenta. Next is abnormal amounts of amniotic fluid. Amniotic fluid abnormalities are more common in multiple pregnancies, especially for twins that share a placenta. Next is the postpartum hemorrhage. The large placental area and over-distended uterus place a mother at risk for bleeding after delivery in many multiple pregnancies. And lastly, the cesarean delivery. Abnormal fetal positions increase the chances of cesarean birth. A cesarean section is a procedure used to deliver a baby through an incision or cut in the abdomen. This type of delivery might be used for a variety of reasons, but it's fairly common in multiple births. Your chance of having a C-section for a multiple birth is higher than if you were pregnant for only one baby. However, even in single births, a cesarean section can sometimes be the safest option for delivery. So, eating nutritious foods, getting enough rest, and visiting the doctors regularly are important steps for many pregnant women to take toward a healthy pregnancy. These steps are especially important during multiple pregnancies. And that ends my report. I hope you have learned something from this topic.